All right, great. Thank you all for joining us for Institutionalizing LGBTQIA plus justice in sexual and intimate partner violence prevention. Today, we're going to be talking about creating opportunities through a statewide action plan and what we can all do as Delta and RPE recipients and our position at the statewide level. PreventConnect is a national project of Valor US, sponsored by the US Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the US government, CDC, or Valor. All right, so I'm going to start off with a poll question and ask you all if you have attended the previous sessions of this web conference. Let's see. Okay, so you should be seeing that now. This is the third session in a three-part series, and while it is totally okay if this is your first one, that is fine. It does help kind of inform how we present the information. All right, I am seeing, okay, a pretty good split of folks who watched the first and the second. I am going to end the poll and share it back. So seeing about 60% of people who attended the first and the second, and around 30 to 40% who this is the first one that you've attended. That is totally fine, especially because the recordings are available and you can access them at any time at PreventConnect.org. We covered in part one, centering trans inclusion as a value and a practice, and part two, culturally specific approaches in rural and queer communities. Ashley put the recordings in the chat. Again, you can access those at any time. Actually, we're going to go back. No, we're not, sorry. For those of you who did watch the first and the second sessions, we would love to hear from you. What was one takeaway or standout moment from our series so far that you're bringing into this session with you today? So as a reminder, in session one, we brought Emil from Forge to talk about centering trans inclusion as a value and a practice within ourselves and our organizations, and had a broad overview discussion about the connection between large-scale discrimination and systemic attacks. And in session two, we highlighted two grassroots organizers in rural and indigenous communities talking about the work that they do and how we can support them. As you're thinking about this, we're going to just do a really quick recap, and then I'd love to come back to this question. So with Emil, we talked about not only how we are all impacted by anti-trans hate and violence, but also some practical examples of what prevention that is inclusive of LGBTQIA plus people and centers justice as a value and a practice might look like. So we talked about how liberatory approaches to ending violence are culturally responsive and rooted. They build connection and community. They're grounded in a way that people live, and they move toward equity and liberation. We talked a lot about why it is our work to create connected communities, to end sexual and domestic violence, as well as to protect LGBTQIA plus communities. And then in session two, we brought Reed and Leha to talk about their work in local communities. Leha joined us as an organizer with Wind River Pride and the Wind River Reservation in Wyoming, talking about their work to create drag shows and inclusive pride events in a very red area. And Reed came in to talk about a zine that they have put together talking about the queer South, inviting queer Southerners to tell their stories and connect with each other through online platforms. I'm seeing from Jennifer that the second session was very impactful. It's great to hear perspectives outside of her own, and it made her think about ways that their own agency might reach out to other communities and create more of a shared space and experience. Thank you, Jennifer. That was, oh, they, them. Thank you, Jennifer, so much. That was our intention. We wanted to uplift local organizers and the work that they do to both inspire folks and to think about how we can support local organizations. And that's really great. We got a comment in that session that highlighting the work of local communities is awesome, but it can be hard to think about what that looks like in other states. And that's why we're really lucky to have Marlena and Mary here today. So today we're going to talk about what we can all do as statewide organizations. by highlighting the work of the Michigan Public Health Institute. We're going to understand Michigan's shift in RPE approaches to focus on Black, Indigenous, and disabled Two-Spirit LGBTQIA+ communities. We're going to discuss challenges, opportunities, and lessons learned from cascade and participatory grant making to center marginalized communities. And we're going to explore opportunities to institutionalize more participatory and intersectional approaches with Two-Spirit LGBTQIA+ populations in RPE and Delta funded projects. So this is especially exciting because we're hoping that this is something that you all can take back to your organizations and see an organization who's doing it with RPE and Delta dollars and how we can do that ourselves. Before I pass it on, I also want to highlight Harriel saying the first session really touched my heart, especially with the poems that were brought up. And the second session was incredibly informative and amazing to witness. Thank you, Harriel. All right, and with that, I am going to pass it off to Marlena and Mary. We are so excited to have you all and to hear about the incredible work that you're doing. Ashley and I have been inspired just from our pre-conference conversations and just really happy to have you here.
Thank you, Janae, and actually appreciative of both you and Ashley inviting us to come in today. I hope we can make this presentation good for all of you, but short introduction, my name is Marlena Moore. I use they, them pronouns. I am the project coordinator at the Michigan Public Health Institute. And we both, Mary and I, are working in the Center for Healthy Communities within there, and then in the Office of Gender, Sexuality, and Violence Prevention. So I am going to pass it over to Mary to introduce herself.
Right. Thanks, Marlena. Again, Mary, she, her pronouns. And I'm an evaluation specialist here at the Center for Healthy Communities within the Michigan Public Health Institute. And yeah, just excited to be here with you all today. A little bit about how we're going to structure this is the first 3 sections, we've got 4 sections. The first 3 are really going to be just telling you about sort of the background and the journey that we've been on here in the state of Michigan around this work. And then the 4th section will be really what are some of the key lessons learned and how to better engage with 2S and LGBTQIA communities in the RPE work. And then hopefully we'll have a little bit of time for some questions. And if we're really doing well on time, we'll have time for some small group work and sharing and reflection on how you may be able to implement some of these things moving forward. Okay, so a little bit of background. Who is MPHI? So we are the Michigan Public Health Institute, and we are a subcontractor with for the Michigan Department of Health and Human Services. So we have done this work in partnership throughout the years with Jessica Griswack, who's the program director at MDHHS. And I also just wanted to acknowledge that Sarah McGurr, who is also here in the space with us, is really sort of has been a lot of the brain and thought power behind a lot of this work. She's in a little bit of a transition work-wise right now, but we're everything that you see here is informed by all of the work that she has been doing for years and years in the field of sexual violence prevention. So we will have the opportunity to learn more from her expertise as we go on through. So where did we start? We couldn't go all the way back, but we thought we would look at a statewide sexual violence prevention survey that we did in 2019. And that was really looking at, it was a statewide survey intended to provide data to be used by those who are working to prevent sexual assault, abuse, and harassment. Oh, thank you. I think I'm getting a little bit of a delay when I hit the button. So hopefully that will stop. So as part of that survey, it was really to help folks in Michigan think about what their role is and helping to stop violence. However, in the following months after sharing the survey, we got a lot of feedback that not a lot had changed. First of all, that was one of the findings. And while it was really useful information and provided a broad cross-section of attitudes and beliefs around sexual violence throughout the state, and what we didn't have, there was some gaps in our understanding, particularly around sexual violence and its risks and protective factors, and how they unequally harm some of the most under-resourced communities in Michigan. So we really decided that we needed to have a little bit more of a focus to our work. And the gap that we identified in our understanding was really around LGBTQ communities, Indigenous folks, Black and disabled communities. So out of those conversations was born the Community Sexual Violence Prevention Assessment. There we go. Okay. Okay, so what was the point of the CSVPA? It was to guide efforts to end sexual violence, again, with a focus on these core communities that we knew were at a disproportionate risk of sexual violence, and to do it in an intersectional way, and to help inform national, state, and local prevention efforts. We wanted to inform those who are working on the connected risk and protective factors in other fields, sort of how do we engage folks who are beyond the, for lack of a better term, the usual suspects in terms of sexual violence prevention work. And we also wanted to help folks think about their own role in how to prevent violence at the primary level. So what we did then was we brought together folks who were working, who are rooted in these core communities, with a focus on those who needed to be actively engaged in the process to make it meaningful. We realized that to do this work with these communities and to do it well, their voices needed to be at the center of how we went about doing it. So it wasn't just, oh, we need to interview folks, you know, LGBTQ folks, Black folks, disabled folks. It was really, we need to bring those folks to the table so that they are driving the process, or at least have an active voice in it. And we'll talk a little bit more about some of those dynamics in a minute. So we decided for the CSVPA to focus on 4 risk and protective factors. And we focused on these because we felt we could reasonably be expected to make a change at the community and society level. So community connectedness, so the extent to which the individuals feel connected to their communities, since that's associated with positive individual and social outcomes. Thank you. Again, sorry, my slide moving is not working. So Marlena, I will let you take over that since my computer doesn't seem to want to do it. We also looked at economic wellness, so present and future financial security, supported by equal pay, leave benefits, microloans. And then we also looked at bodily autonomy, so the right for a person to govern what happens to their body without external influence or coercion. We also included within this consent, within one's own sexuality, medical needs, interactions with the systems that folks are interacting with. And then lastly, community safety. So being able to safely engage with community supports without fear of experiencing shame, stigma, bodily harm, or death. And we know that, you know, no single one of these protective factors is going to entirely shift the environment, but that it's a combination of these many factors that might actually begin to really move the needle in terms of preventing sexual violence. Okay, so the CSVPA Advisory Committee like we said before, was really crucial to how this work was done. And it was a group of folks who were doing sexual violence prevention on the ground and had been doing it in different ways, but were well known and rooted within the core communities that we were hoping to look at. For their participation in the advisory group, they were compensated. If they weren't being paid to be part of it as part of their regular job, we did compensate people for their time to be part of that advisory committee. Again, we felt it was a core value of ours was to recognize that as people with lived experience and implementation, that if they were going to help guide this process, that we compensate them for their expertise and time. And so this group really guided the design and data collection for the assessment. And just an example, some of the partners were, Equality Michigan, which was working on LGBTQ issues across the state, some violence prevention organizations, the YWCA, disability rights organizations, and that kind of thing. So part of this process, we deliberated, did a lot of thinking around it. We collected data, and that data included some key informant interviews. We looked at some secondary data and did a literature review related to sexual violence and the core communities. Then after the data collection process, we collectively worked through the data to make sense of what we'd heard from folks. And the CSVPA advisory committee met to look over the data. We met with the advisory committee to do sense-making sessions. So we've gathered all of this data. What does it mean? What do we do with it? So again, through a series of conversations, trying to do some sense-making and meaning-making. Us taking that feedback, synthesizing it, writing it up, and through a series of dialogues to really come up with some key findings that could be actionable. And then eventually created some dissemination products and shared that out pretty widely. And we will make sure to drop in the chat a link to all of those materials, because we're not going to go over all the findings right now, but we wanted to let you know a little bit about sort of that groundwork that has led us to where we are today. And then again, so after that, the CSVPA was done and we had shared that data, the decision was made that, maybe the way the money was distributed or how we do things might need to shift. And so MPHI, who had been, a support for the work for a long time, was selected to be a direct pass-through to expand and improve the capacity to do community prevention level work with these key communities. And I'm going to pass it over to Marlena to talk about what we had to do internally at MPHI to get ready to do this next phase.
Thank you, Mary. So yeah, in recognition that we wanted to be as well situated, if you will, to do this work, we also realized moving through the CSVPA process that our team needed to do some work internally. And this was to hopefully be better collaborators with community partners. And then I'm going to go to the next slide. Like this mentioned, we needed to engage new partners through the needs assessment, the needs and assets assessment, and then moving into our participatory grant making project that is going to be detailed later. We wanted to authentically engage these partners in decision sharing. And then going into the next portion, we realized that there were some challenges related to this. So knowing that we, as the Michigan Public Health Institute, we are a formalized nonprofit institution, and we do a lot of great work, especially when it comes to evaluation and doing improvements for public health needs. But we also recognize that when it came to partnering with 2S LGBTQIA orgs, we had a sincere lack of trust, credibility, knowledge and skills, resource and support, and accountability and feedback between us and this network that's across the state of Michigan. So we were knowing that we were branching specifically into working with these groups, we had to move from a more transactional engagement situation into something that's more relational. So going through that, we had to assess staffing capacity. We knew that we as an org or as a team actually worked with consultants to actually support us in doing better, if you will. So understanding what assumptions or biases would come with the lenses that we have through our own experiences. And even though we are a feminist group within our center, we know that there was a lack of intersectional understanding of how marginalization happens. So understanding how, even though a person is part of the queer community, them having a disability or them being Black or a combination of both would impact them further than if they were just somebody who quote unquote somebody who was white, cisgender, and probably male or female. So then going into the internal capacity building, we as a group had regular team meetings where we did readings, we did we did readings, we listened to podcasts, and then we came together and had in-depth discussions on what all of this meant for us, especially as it relates to the project or to our team doing sexual violence prevention. So we can talk about, hey, this is something related to the disability community, but we have to be mindful of the fact that our work is in sexual violence prevention, and how is sexual violence, how does a person with disability experience sexual violence compared to somebody else who does not have a visible disability, if you will? So we developed some guiding principles within our grouping. And the first one is approach everything using an anti-oppression intersectional lens. We practice this by questioning and working to change the ways oppression shows up in our thinking, organizational systems, and cultural norms of work in society. And it was with the goal of replacing oppression with equitable ways of sharing power. And then we were doing prioritizing, like we prioritize learning and sharing. We recognize that we have much to learn from our communities, but also with the knowledge that we have institutional information that could be supportive for communities to engage with. I guess when we're moving into the grant making progress, getting their voices heard and getting them centered. Sorry, I see the question in the chat. We have been doing readings, but at this point in time, because of how busy we all have gotten, we've kind of stopped those meetings for the short period, if you will. I know that we are planning on getting back into them, hopefully at the beginning of the year. And then I think going into number 3 is where I stopped. So foster intentional, authentic relationships. We must honor and affirm every person's inherent dignity and build the trust and transparency needed to hold each other accountable in what we say and do. So we recognize that conversations are going to be hard. They're always going to be hard, but you can only build relationships by being able to listen to somebody's truth and being able to appropriately respond and learn from that too. And then number 4, implement adaptable prevention strategies aimed at root causes. We know that there are innovative community and society level innovations that are happening that are addressing the root causes of violence. This includes bias and discrimination against groups and individuals based on their race, sex, and or ability. So we think that it's imperative to think on what pieces of projects that we see can be adapted to meet other organization and community needs. So like, you can't just say this participatory grant making process that we did is something that you can just copy and paste. We know that because everybody is from different states across the country, and also everybody has different access points, it's not going to be a one-to-one, even if we give you the formula on which we utilized. And then so 5 is practicing data equity. We have continuously tried to make sure that the mean making process centers the perspective of the people most impacted by these issues. So we, as the people who are institutionalized, if you will, have a lens that we usually view things through, but like we may not have the community-based knowledge that identifies like why it is that I'm gonna go off of like my understanding of Michigan, like why it is in Detroit that there is a concentration of Black trans women who are in need of services more so than if they were on the western side of the state in, I guess you could say, Grand Rapids. And all of this led to our participatory grant making, which part of me thinks that's why most of you are here. So this this assessment that was developed, it culminated into this project. This opportunity was designed collaboratively with our community partners and funders, and the intention was to develop a grant that was accessible. And by accessibility, I mean to make sure that non-mainstream organizations, even though we know mainstream organizations provide supports to people who are part of the 2S LGBTQIA community, we know that most of the time that's not their focus. And we wanted to gear this towards those who focus on those sort of supports, especially those who work at the intersections. So when we created this, we did the design collaborative, which is the grouping that we called ourselves when we started this process. It's made up of community partners. This means organizations that are culturally rooted and consultants who also have expertise in the identified focus areas. And then also the Michigan Department of Health and Human Services, like Mary mentioned earlier, the Rape Prevention and Education Director, Jessica Griswack from MDHHS was like a very large part of this process as well, providing like supportive containers for us. And then the Michigan Public Health Institute, who we are. We had various project staff from the Office of Gender, Sexuality, and Violence within the Center of Healthy Communities. Like Mary had mentioned, Sarah McGurr is actually in this webinar right now. Hopefully if she has any sort of like thoughts that she'll be able to like either type them or get off mute if necessary at a later time. But she was the lead for this project, along with a number of other staff members who were there before Mary and I started. So the two of us came in like halfway through the grant making process. So we have this experience, but there's a large number of information that's floating around other places within MPHI. So this banner is the banner that we used as part of our meeting introduction, I guess you'd want to say. So the design collaborative met from September of last year all the way up until May of this year specifically. And this was like the image and then the idea that we were centering ourselves around to make sure that we could work. We had a container, if you will. So Cascade participatory grant, Cascade is the grant that we have, and it's participatory grant making project. It focuses on 2S LGBTQIA folks who also identify as Black, Native, and/or disabled. So based off of the CSVPA that was mentioned earlier, this is how we identify that we wanted to create our focus. All right. And then, so we have a consent principle. We realized that because we're doing this work in collaboration, we had to adopt some sort of decision-making support. Obviously, if we're looking at this graph right now, it looks a little complicated, or not complicated, but it looks very in-depth, where you go from discussion, proposal, making sure there's consensus, and if there is none, like people having a larger discussion that might go back to the discussion phase. And if it's yes, we can get a consensus achieved and then pass the action. As a grouping, we realized that this was going to take a long time, but we also accepted the necessity of it, knowing that relationship building needed to happen. I feel like us being able to have these conversations, because obviously not everybody agreed on everything, it allowed us to further understand each other because of the conversation that happened. And for the members who were part of the design collaborative, the community organizations were able to relate to each other more, along with us being able to relate outside of, I guess you want to say, institutional values, if you will. And with this, just know that we're going to have a larger, I'm going to present more context, if you will, moving into the next couple of slides. So part of this consent principle was realizing the container on which we were working with everybody. And we used this tool called the range of community collaboration to identify where everyone was sitting. So obviously the first one is community driven. So the design collaborative, who was not the SVP team within MPHI or MDHHS representative, like we were the ones who were just like, okay, you tell us what you need and we're going to pass it forward. And then knowing that the next level up is collaboration, where the team would look to the community for advice, and then include the advice and recommendations to the maximum extent possible, knowing that there might be I guess funder related issues that might come along with this. So I'm trying to distinctly remember one of the things that came up. Like we know that the point of all of this was the focus communities, right? So there was a larger discussion, or there was a discussion that Mary brought up earlier about the risk and protective factors. We were talking about community connectiveness, economic wellness and supports, bodily autonomy, and community safety. We presented those risk and protective factors to the group and verified that the community connectedness and the bodily autonomy were the things we wanted to focus on. And there was an agreement related to that, which allowed us to move to our next level of discussion, if you will. And then thinking about involvement, we wanted to work with the community to make sure the concerns were reflected. But alternatively, we were the ones who had to make that final decision on where things needed to go. And then consultation was sort of similar in nature. In how we were hearing what was being stated by the community partners to make sure we understood their viewpoints, but also being mindful of where we had to sit as an organization in the funding stream. And then obviously for the funder-driven information, we had to make sure that there are funding requirements. So like CDC has requirements specific to grants, and we could not fall outside of that line. And we had to like make sure that people understood those as well. This fun graph, I'm sorry for anybody with accessibility issues right now. This is essentially putting that range of collaboration into like real time, if you will. So we can see like at the top, you've got the community driven collaboration all the way down to the funder driven. And then to the left going down, these are basically the parts of the grant making process that we all were doing together. And obviously there's a lot of little dots markers all over the page, but in recognition that this is where the more dots you see, the more it's leaning towards something compared to like if there's nothing at all. Ooh, thank you, Ashley. So this graph is like an updated version of it. So the one previous one was where we started at the beginning of this process. And as we moved forward into the second half, I guess you'd want to say, of the design collaborative, where we're physically making the grant document itself. These are the decisions that came up, and then some of the decisions that started off as more community driven or more consultation driven were kind of like moved in different ways depending on what we thought was appropriate at the time. We also respect the fact that like everybody wants to be engaged as possible. We recognize that everybody who was in the design collaborative were coming into this process, not just because they were getting paid to do it, because they were really invested in doing good work. So sometimes it felt really bad for us to say, hey, this is something that we can't have you have your complete say so in it, because we recognize there's a necessity, but we also are part in we also recognize that given the fact that we were working with two LGBTQIA organizations, and then Black-led organizations, Indigenous organizations, and then also disability-focused organizations, everybody had their own focus that they wanted to bring into the space that sometimes was not aligned with each other all the time. And that's just part of the process. That's why we got everybody together. So in order to make our decisions, we use this called the Fist of Five tool. This Fist of Five tool is, I can actually put the source of it into the chat, and then recognize that we use this as it was interesting because almost all of our meetings were on Zoom. So trying to figure out how to play, like how to have somebody put a fist or 1, 2, 3 up in an equitable manner that did not make it feel like we were forcing other people to agree with this same position. It was a kind of interesting thing. And like Mary put into the chat, it's something where we wound up doing Zoom polls after a while. So as you can see, we have like the 0, like the fist, the 1 and the 2 are part of the lack of consensus idea marker. So if we put a proposal forward, like say we want to say adopt the proposed levels of collaboration for each decision presented, and that's part of the previous slides. If somebody puts a 0, 1, 2, they say like, hey, we don't really want this. We may be swayed, but we don't want this completely. And then you have the consensus, which says 3, 4, and 5, which goes to like what sort of changes could be made, or like, I love this absolutely. If at any point in time we had a group member say 0, 1, or 2, we had to stop the progress and say, we can't adapt this. What sort of discussion needs to happen? And then what sort of discussion needs to happen in order to move the individuals who were at least at a 1 or a 2 to get them to move towards like a 3 at least. And sometimes those decisions actually worked. Sometimes we had people who completely abstained from the process. And then once again, we had to have a larger conversation, but this is part of the work to make sure that everybody's voice was heard. And while we don't particularly think that we can get a unanimous decision on saying, hey, 5, love this, we'll champion it from everybody, we at least wanted to get to a point where people were comfortable making sure we can move forward. Right. So this work with the Design Collaborative culminated into the Cascade Grant, wherein we produced a request for applications. We didn't like the terminology of request for proposal. They were proposing projects to us, but the way that we had presented it to them was a very short application because we wanted to make it accessible. So the information, we tried to make it accessible to a large group of people by putting it into a Google Drive. There is conversation that could be had about how accessible Google Drive is in and of itself. Obviously there's issues with like screen readers, and there's also some wonky weirdness of uploading an Excel file sometimes, but also Word documents that have a lot of like design factors in them. Uploading it into Google Docs is like not one-to-one. So we had a lot of difficulty. Most of the items that we had to upload were in PDF form, but the ones that there was a part where we had to have work plans and then a budget plan that people needed to utilize, and those could not be locked down, I guess you'd want to say, which led to some weird issues where sometimes we would get emails from applicants asking for the actual documents themselves from us directly. So we had these grant materials. We tried to make it as supportive as possible for people. Like the application system was a survey for I think was no more than 30 questions long. And I recognize that for us, we were like, this is going to be like accessible. This is going to be helpful. At the same point in time, I think we are recognizing we may not have asked the right questions while we were trying to simplify the process. So it became interesting looking backward or back after all of this had been done to realize that we tried to make it simple. Sometimes it was not made as simple as we thought it was. And we had to go back after the fact and have further conversation with the applicants who we were moving into like the final grouping, if you will. So the Cascade overview of it in itself, though, was we had a program North Star that we utilized from the design collaborative all the way into the applications, where we wanted to create productive environments and promote positive social norms that support Black, Indigenous, and disabled 2S LGBTQIA plus communities in flourishing and stopping sexual violence before it starts. The aims were to increase bodily autonomy and community connectedness. And then the project period, it starts, frankly speaking, at the beginning or the end of this week, Friday, and it's going all the way until September 2028 at the close of the actual full cycle grant. We have 5 budget cycles. We identified through the Fist of 5 discussion of how much we were going to fund. So we identified it was going to be a max of $100,000 per each awardee, if you will, and also put a cap on how many people we wanted to actually fund for that. I think this is the end of my portion. I'm going to pass it back over to you, Mary.
Awesome. Thank you for giving us the whirlwind overview. Again, I feel like any one of those components we could have spent a little bit more time on, but wanted to try and get as much in as possible for you all. So I'm going to talk a little bit about sort of some of the lessons learned along the way, and I'll be drawing on some of the things we've talked about and bringing in a few more examples as we go. Some of the lessons, I will say, may feel a little bit similar or repetitive, but we really wanted to be comprehensive and provide you all with some food for thought, no matter where you're at in your journey for meaningful engagement with LGBTQIA communities. And again, once I get through these, we'll have some time to think a little bit and reflect on how you might be able to take some of this work forward. Okay, so first, our first lesson is do your research. Again, MPHI research and evaluation is most of what we do. Grant making is a newer area of work for us. So we're coming at this from a data and research background. But knowing that helps direct you where you need to go. So before you start doing a lot of outreach, or maybe simultaneously, it's good to do a good solid literature review. Maybe you have some primary data that you've collected in your state or in your location. And maybe it reflects the views of and perspectives of 2S LGBTQIA communities, and maybe it doesn't. You can also look at what secondary data do you have. Is there something, other data from within the state? I think it's always useful to look at universities who are doing research locally and see, what are they doing? What kind of data can we get from the state level or the local level? Again, because that's just, knowledge is power, data is power. And so looking at that will help sort of ground you if you're just starting out with this work. And it can also, you can take a look at who folks are partnering with at the state level to see, who's active in this space. So the second lesson learned is seek and follow the guidance and input of queer organizations and leaders. This should also say, and Black, disabled, and Indigenous organizations. So when we, again, back, several years ago, when we approached the queer organizations to learn more about them, they were already doing a lot of work around systems change with these populations. And as we made the connections, we learned to really prioritize our approach with humility and honesty, recognizing that it wasn't our area of expertise, that we were bringing some strengths in terms of our background in sexual violence prevention space, and to just show them that we were there and ready to learn from them, and really taking a listening approach to hear about the great work that they were doing. A lot of organizations are pretty, especially those that are representing marginalized groups, are really wary of government agencies and large partners, partially because they've been screwed over in the past or have seen it happen to other similar organizations. And so we recognized that it was very possible to enter into this work and recreate some of those oppressive dynamics that we're actually really trying to change in the broader community. So how we approached those partnerships was really crucial. The third lesson learned is commit the time and resources necessary to do the internal and messy work. So shifting how the work is done is hard, is messy, right? The things had been done a certain way for a long time, and prioritizing these groups, folks in the design collaborative, the advisory committee for the CSVPA, it was a shift, and it was trying to give them more voice in the process, but inherent in that process is also giving up a little bit of our own control as a large institution. So I think by investing that time and energy in reflection on ourselves, I think it really helped us to make sure that we were doing the work in a values aligned way that really prioritized, again, those guiding values that we mentioned at the beginning, so that we were not just doing good work, but we were doing the work the right way as we were going through. But it took a lot of time and resources to do that work and to do it well. So again, just some questions to think about, or how are you currently, what are your strengths or gaps related to participatory work? How will you identify the internal work that you need to do to further the work? And just be prepared to work through the messy feelings that come up when you're stretching to try to do work in a different way. I think for us, by naming that it was going to be messy, it was still hard. There were still hard conversations and there was still some discomfort, but because we knew that it might be messy and uncomfortable, we had some tools for how to prepare. And when things got messy, we acknowledged that they got messy. But building in time for the mess and the conversations that need to happen is a little hard, and it's a little hard to put into a work plan. So just something to keep in mind. And again, this is sort of a repeat, but yeah, just embrace that things are going to be a little bit messy, and they might not feel as linear as we're used to. Again, being in public health and prevention work, right? We like a good logic model. We want it to be sort of neatly laid out. We want to do steps 1, 2, 3, and get to an outcome, get to our intended outcomes. And when you're doing a participatory process and shifting some of that control, it doesn't always work quite that way. So again, embracing that and then figuring out how to communicate it more broadly is just an ongoing investment in time. All right, so that's about sort of some of the internal work. And then again, if you're already starting to do some of this work, assess and acknowledge your current approach and gaps in terms of your partnerships and relationships in the field. Inevitably, everybody already has some relationships with organizations. So it's a good, again, part of that internal mapping is to take a look at where are your partnerships, where are they strong, where do you have representation from to us LGBTQIA communities or not, and again, in our case, we're also looking at Black, Indigenous, and disabled LGBTQIA organizations. So, sort of assess where you're at with your current partnerships and identify where you need to improve your understanding, practices, and policies. And then, again, some questions to kind of ask is, as you're doing that is, if you do have some of those relationships, are there places where there have been missteps or where there might be some tension in those relationships? And is some repair needed before you can move into more authentic and meaningful partnership and dialogue? Again, like we said before, a lot of these groups have been screwed over by larger organizations and by the government. In states where there is current legislation that dehumanizes and degrades people's existence, you can understand where there would be some hesitance to partner. So really looking at that as you move forward. And again, understanding that larger environment. Again, what partnerships do you already have in place? But also just understanding what's going on in the bigger community beyond you and what you're doing. And who are some of those partners that may not be the usual suspects. And again, as you start to understand the environment, realizing that a lot of that's going to happen. It's not just going to be looking online at resources, but it's also going to be, having conversations with folks, and that relationship building is going to take some time and investment. I know, having done a lot of public health work, sometimes we don't set aside that time for relationship building with partners. It's sort of an afterthought, and that time isn't there. So just recognizing that and making space for it as you move forward. And this working to rebuild trust with organizations from the start. One principle that the team found useful as they were beginning some of this work is this concept of braving, as conceptualized by Brene Brown, which captures sort of the essence of trust, right? So I'm not going to read those all to you there, but we wanted you to have that as sort of a just sort of a guideline and something to think about as you're working to move forward. And again, and I told you these were going to sound repetitive, but I promise they are distinct. Part of how we fostered meaningful and sustainable relationships with folks was to really try to push beyond sort of this professionalism and sort of the way things had been done, and to embrace more vulnerability, admit our mistakes, admit where our learning edges were, and really listen. And then respecting the expertise of the folks in the room, and compensating organizations for their contributions. A lot of the folks who we partnered with on the design collaborative were smaller organizations that didn't have a huge budget. So they wouldn't have been able to provide the time and energy to help design the Cascade grant if we hadn't said, no, like your expertise is meaningful and valuable. And, you know, we paid them for their time to help shape the project. And then offering support beyond the project. This has manifested in a couple of ways. And part of that is because we do a lot of public health work and we're working on health equity in a lot of different spheres. We've been able to leverage a lot of those partnerships in other areas of work. For instance, you know, doing work, we do work on maternal and child health, or we just did some work around family planning, and we were able to contact some of those partners that we've established those strong relationships with and say, oh, do you have any, you know, folks who might be interested in participating in focus groups around, you know, family planning or maternal health. And so, you know, we've been able to really build out our network and our connectedness throughout the state of Michigan through this process. And it took a lot of time and effort. And in a moment, maybe Sarah can share a little bit more about that. But I think it's a really, yeah, it deserves to be said. All right. And so the last one we're going to talk about right now is actually being prepared to code switch. And this is something that I think Marlene and Sarah can also speak on quite well. But that's primary prevention doesn't always look the same. And there were a lot of organizations in the state of Michigan who were doing primary prevention work, who are doing work around bodily autonomy and connectedness, but they weren't necessarily coming at that from a sexual violence prevention perspective, or with that as their lens. And so knowing that there's a lot of folks out there who are helping to create more connected communities, to build more understanding, but that it might not look like what we've seen in previous RPE or SVP grantees. So one of our jobs was to really look at the language or look at the work of the organizations and say, oh, no, what you're doing is sexual violence prevention, right? Even if you haven't identified it as such. And so helping to sort of draw those links between what, you know, what was done previously and what are those outcomes and how what folks are doing, I think, you know, and shifting some language can be really powerful, because there's a lot of folks who are doing work that is sexual violence prevention, but they don't know it, or they haven't identified it in themselves yet necessarily. So I think that's one of the big lessons that we learned as we were going through this process, because and Marlena can speak to this a bit more too. You know, we got some applications and some people are like, well, that wasn't primary prevention. And it was like, oh, actually it is. And trying to kind of draw those connections. That's really important. And then the other piece, and this is, again, it all goes back to relationship building and dialogue, is gathering ongoing feedback and showing how you're responding. So throughout the CSVPA process and the design collaborative, we're gathering feedback and input from partners constantly, and then showing them the changes that we had made, whether that be in the documents for the grants or you know, who was going to be eligible, and really showing people how their expertise and feedback was being fed into the process was really important to build trust, but also just to ultimately make, you know, create a stronger grant process overall. So with that, I feel like I sped through it. Yes. I was hoping maybe Sarah, if there's anything else that you would want to share real quick, otherwise we can go ahead and open the floor for a few questions, and then we can do our little group activity.
I don't have anything to add right off the bat, but nicely presented, y'all. And I'm here if anyone has any questions or wants any more specifics about a certain piece.
Thanks, Sarah. I appreciate that. I will say that a interesting follow-up would be related to relationships. So be mindful of what communities are actually in your state or in your general area of support, if you will. Something that we needed to acknowledge as a group was we wanted Indigenous, like tribal populations to actually be part of our design collaborative. And we had a difficult time actually getting them engaged. And that's largely because there was a needed knowledge, there was a knowledge gap that we had in relation to what community building actually looked like with the tribal units within our state. So us just frankly saying, hey, well, I could say like the Pokagon tribe within the within Western Michigan, hey, do you want to work with us? Do you have anybody that you would like to represent? And not getting any sort of response, because like Mary had said earlier, what does trust look like between us as an institution that gets money directly from the government usually for them who have repeatedly been misaligned, if you will. So it's always a good time to try and think about, like, you may want to start this process as early as possible. I would probably suggest a year just in case.
That is such a good point, Marlena. This is Sarah. I would just echo that and say, with the Native engagement work, we realized that we were trying to move at the speed of trust. We left, 6 to 9 months to reach out to make a list of organizations locally to try to work our existing networks to get a warm introduction wherever we could. We did some just sort of off the cuff emails and calls to people to try to get meetings set up. But the most successful strategies we had in engaging anyone was using community organizing techniques. So if you know a community organizer, or maybe turn to that, books around that, literature around that, I would definitely recommend that, because that is such a great, some really great strategies for building power and getting buy-in, because even at the rate we were going, 6 to 9 months was not enough to engage Native organizations. To build those initial relationships, we had 3 to 4 meetings with people before we even decided if, mutually decided we were a good fit to be on a design collaborative, let alone be in any sort of funding relationship. So there was definitely a lot of time set aside. And a lot of that was done virtually. Almost all of it was done virtually. So good relationship building can happen online, but it does require intentional facilitation and creation of spaces. So definitely don't, when you're making your kind of timelines, keep in mind that you need to have really intentional conversations as well when you're doing that relationship building.
Also going to say, based off of that, give yourself space for the process. Sarah, Mary, and I, when we were in this design collaborative process, we recognized that we kind of had a timeline to implement, and it meant that we were kind of on, like, we were just ready to go to the races as soon as Mary and I both started. Every other week we were meeting with the design collaborative and giving them like materials to review, to give them like, and then we were looking at their commentary and feedback and trying to implement it when we came to the next meeting, which meant that we were basically trying to run a month ahead of what was actually happening. And in some ways it felt very rushed for us as the MPHI team. And I also realized that for the design collaborative members, they also felt very rushed in relation to that too. So just be mindful of that. You don't want to burn yourself out. And then I saw that there was a question too, sorry.
Oh yeah, no, I was gonna say, one of the questions was, C. Castro asked, how have you addressed tensions between different communities that may be tangential to your goals? And it was like, one of the things that, and we didn't put up the slide that talked a little bit more about the design collaborative members, but many of them they're coming from organizations that were intersectional in some way. So, like LGBTQ Detroit, for instance, Detroit is a largely, majority Black city. So they already have sort of an intersectional lens. So many of the partners who were on the design collaborative held multiple of these identities, disabilities, and the disability rights organization that also had queer people on staff. So I think that helped in some ways, because Marlena and Sarah, tell me if I'm wrong, but my feeling, again, I came in partway through the process, was that these were folks who were living intersectional lives and providing intersectional services to the communities that they worked in. I don't know. Do you feel like there was some tension?
I can speak to that a little.
Thank you.
So a lot of these organizations knew each other, right? This is a small world of LGBTQ serving organizations, even within a large state like Michigan, especially when we look at like statewide, those with statewide reach. So certainly there were some, history between these organizations. One thing that was exciting about this process is that we did peer-to-peer education. So we had people kind of speak to their areas of expertise within the design collaborative. So they spoke about what it's like to be Black and disabled and queer, what it's like to work in disability justice spaces, and how that kind of shows up in LGBTQ spaces, for example. So there was some mutual respect building that happened between community members, and there was some really strong work at the get-go around ground rules. So actually we got feedback from people that because there was that intentionality, and also because we infused fun, we try to have a lot of fun in these meetings. And I think that we heard from people that in some cases it helped to heal some challenges, some previous difficult relationships. So there were certainly times where there were, some of those relationships came up where, people were, for example, on different pages when it came to Israel and Gaza. And there was some, kind of offline discussions that had to happen there about how can we continue to work together, even if we are on different pages about this particular issue. Or there were differences around, whether to how to prioritize limited funds when it comes to different kinds of initiatives. So there's always going to be those tensions present, but I think by trying to make it kind of human first, meeting each other around our North Star and those shared guidelines was, I think, pivotal.
Couldn't agree with that, especially something that I heard from a former team lead of mine was leading with curiosity rather than judgment, and making sure that everybody had that sort of like overarching thought process when we came into space was usually something that really helped. And also knowing that, people live intersectional lives, but we had organizations, like people were representing their organizations, and their organizations all had different focuses. Sometimes you would get to the point of people wanting to focus on a specific thing in relation to the topic at hand, like in relation to how we were going to support people who were part of the queer communities that we were talking about. And having to navigate that, like Sarah mentioned, was like a lot of conversation, while also realizing that it's not a pie in a way. Like we all want to support these communities, and we all want to make sure that those who experience like greater marginalization, greater vulnerability are the ones who actually have access to supports. And I think that was part of why we were focusing on, and we had to continuously reorient that so people could actually like say, hey, this is what this means to us.
Yeah, and I'm seeing a question about getting marginalized youth involved in any capacity. Yeah, and you were saying you've had luck getting engagement from staff from the organizations, but no interest from clients. I will say on the design collaborative, we had representation from the Michigan Organization for Adolescent Sexual Health that does a lot of work around sexual violence. But, and again, many of the folks who are at that organization are young people. But also we weren't set up for like meaningful youth engagement, right? We were meeting during school hours for this. And so I think if we had a youth focus, our design and approach would have looked very different. So I, part of me said like, oh, but if you've got, engagement from staff at the organizations that do have a youth focus, they're probably going to be the best conduit. And another thing that I don't know that we mentioned was, many folks on the design collaborative, they were people who had experiences with sexual violence because it's everywhere, and we all do, but we didn't want people to have to do a lot of emotional work, and so people who have maybe haven't fully healed from some of the trauma, we didn't want to be bringing, if that came into the space, great, but we didn't want to be prioritizing that. I think it's okay maybe if youth clients aren't ready, and there's some resources there that folks have shared that can maybe help you start moving that needle a little bit, but yeah, that's a tough one.
I'll just add to that, that was feedback that we got from our external evaluator who was helping us do our equity assessment was, hey, you have a lot of representation from professionalized organizations representing these populations, many of whom are, the focus populations have those identities themselves, but they recommended that we should have more engagement of community members who are not in professionalized positions. And we had done that with the community sexual violence prevention assessment work that had happened, but that just, unfortunately, we did not do that with this particular process. And, it was something that we really, really thought about, but at a certain juncture, it's really challenging because you have so many opinions and so little time in some ways. If you're following a funding schedule and you have to get money out the door, right? So we really, really grappled with that about like how many opinions at a certain point is too many opinions to be able to make decisions, because it can truly be immobilizing. So I don't have a good answer for that. That was something that we didn't do particularly well.
I think it looks like we've addressed most of the questions in the chat. Did anybody else have any other questions or want to come off mute?
I actually have a question, just because I like the details. I'm kind of nosy too. So I'm just wondering if you could share with us, like, what were you surprised at the applications that you received? Can you tell us anything about them? Like, how many did you receive? How many were you able to fund? I'm just interested in kind of where y'all landed with that.
Breaking news.
I was going to say, so we made our formal decision about that, like essentially last week. So we're officially funding 3 organizations. One is in the eastern, or sorry, I keep forgetting my geography in the state of Michigan.
I think we should probably avoid naming particular things just because we haven't actually sent out the letters yet.
Good. All right. Because I was like, I don't want to share more information than necessary. So We
Sorry,
It is
funded,
good to know. You funded 3.
Uh,
That's amazing.
funded 3. We had a very good group of applicants where it was interesting realizing that there was a distinct understanding and misunderstanding, I guess you'd want to say, of what counted as primary prevention and what people viewed as like not primary prevention, if you will. So well, no, I'm going to rephrase that. There was a misunderstanding of what people saw as primary prevention. So we had some applications and we were like, this is good, but you're working at the individual level and we're trying to make like community societal related change to norms. And they were like, we're going to do something similar to direct services. So that was like some things that we wound up seeing in there. And then like something that was interesting was like the culturally specific ones that came through, where for at least one of the applications, they were like, yes, we identify culture as prevention. So if we're talking about culturally specific communities, especially like people of color, there is this like, how do I engage with my community and specific cultural practices that is like part of prevention, community connectedness, if you will. So like those were like some of the beautiful things that we saw. And like knowing that we got, it was under 20. We got under 20 applications, which as a person who was doing some of the administrative review, I was thankful for. And it just ran the gamut across there. And like, I was so grateful to see everybody across the state and what they were actually doing. It made me appreciate the work that we are doing and also the work that is seen but unseen, I guess you'd want to say, across the state.
Yeah, and it's I think we got largely applicants who had never applied for sexual violence prevention funding before, so that was exciting. We did a lot of outreach via kind of non-traditional tracks as well. We used the networks of our design collaborative members a lot. We developed kind of an announcement that was graphically designed to be kind of eye-catching and beautiful, and then had them spread that kind of far and wide. And we even talked about, having it present at and people talking about it at Pride festivals when they ran into like new and different organizations that were perhaps just starting, trying to think of other ways to get it out rather than, well, we posted it to our, to these 3 mainstream sites and people need to go find it themselves. So being more proactive with that outreach is important. Yeah.
Thank you. Thank you for sharing that. I know, I'm sorry. I didn't mean to ask you for like to spill some tea, but that's super exciting. And I mean, I think personally, I can't wait to hear what they do with the projects and check in with you all, in like a year's time, and maybe tell some really great stories about what they've been able to do in practice and actually hear from your new recipients. That would be super cool. I didn't know you were a librarian, Marlena. That is so cool. Now I have lots of other questions for you, but we'll do that offline. Janae, I'm going to pass it over to you to see if you have any questions.
I think, the thing that comes for me, especially because this is so new for you and this is so deeply rooted in your values, what is your hope for the future of Cascade and the work that you all have started and I know will continue forward? I mean, I'm hearing 20 applicants and three organizations funded for like the first time is huge. And I'm like, I can't even imagine what the future looks like.
One thing that was exciting, I think, about moving this all forward is that there are a few statewide LGBTQ focused organizations in Michigan, but there's not a network of organizations that's explicitly focused on these intersections, on kind of the margins of the margins. So I think the opportunity to have our funded grantees connect with one another in ways they might not have previously with an explicit focus on these intersections they may not have even known each other previously. Is a great opportunity, but I hope also to continue to engage some of the other groups that applied in some way or another, whether that be through a community of practice or some kind of network or initiative. I know the tribal work that's kind of been a separate circle in and of itself is also building a network of Native, Indigenous focused folks who want to build a similar kind of network specific to Two-Spirit and indigiqueer folks. So there's, I think, a lot of opportunity for kind of people power building that can happen to really elevate the voices of existing work and the importance of these intersections in prevention work and just in our state more broadly.
Amazing. Thank you so much. We are at the end of the hour. So if it's all right, Mariana, we had talked about maybe having time for a group. We only have 2 minutes left. So what do you think?
That's all right. I was gonna I will put in the chat just sort of as a way to close out. I'll leave you with a question, and maybe folks can come off mute if they want to, or put it in the chat. But just after having seen this, what are some next steps that you can take to shift how you meaningfully engage with 2S and LGBTQIA communities in your work?
I love that. Yeah, we have a couple of minutes as we wrap up. Would love for folks to share responses to that question in the chat. I think that's a really beautiful way to end this space. For all of you, well, thank you, Mary, Marlena, for your time and your expertise and the incredible work that you do, and Sarah as well. Thank you all for being here. Really hoping to see some of those answers in the chat. But as we wrap up, there will be a survey when you close out of Zoom. You'll get a pop-up for a survey. We'll also be sending it out along with the recording, text chat, all of those resources. So please take that survey. It takes just a couple of minutes. It really helps to inform our future web conferences. And please connect with us on social media. We would love to hear from you. We use social media to get a lot of information about future content. Yes, and I agree, Ashley. So we are seeing, thank you, Harriel says, assess what the communities are partial to and how they receive information. I love that. Thank you so much. And Marlena, Mary, you're getting a lot of love in the chat. Folks are really appreciative of this. I'm seeing a lot of people saying that at the statewide level, people who are really early in this process have gotten a lot from what you shared. So thank you so much. And thank you everyone for being here. We are going to officially end the web conference. We're going to reopen the waiting room and start putting folks in the waiting room. So Marlena and Mary, if you could just stay on for just a few minutes, then we'll have our debrief. But thank you all so much and have a great Tuesday.
Thank you for having us.